I'm Evie Warrenbeer. I'm one of the faculty at Broward College, and I'm going to introduce you to our simulation mannequin. We call him SimMan. All right. When we do simulation, the goal, of course, is to improve our skills during a crisis situation. And what we have to have when we do these simulations is we have to have role clarity, right? Because you're going to come in, you're going to work as a team. Some of you would play the doctor or the respiratory therapist, or one of us will, or you might be the team leader, or whichever. But stay in character, so that's a good lesson to have. You need to have good support and use what you have available here for you. And then we need to have an appropriate focus. So remember, whatever the scenario tells you is going on, then you want to stay focused, because that's when you're going to be able to take the skills back to your hospital and translate them into a real situation. Okay, to make all this work, we have come up with an idea of what we call a fictional contract. And that means we have a joint endeavor together that the faculty and the students agree on this fictional contract. And what we as instructors will provide for you is a simulation to the best of our ability given our technology and given our available resources. We might put dressings on, we'll put catheters in, we might give them blood, whichever. That's creating the scenario for you as best we can. And your part of the contract is to have to stay in character and stay with what the scenario is. That way we won't get distracted and we'll be able to move along. It'll help your critical thinking. That's the idea of the whole thing. All right. When you are first introduced to your patient, you'll be told that patient's name, male or female, and what the situation is. And you'll be given the setting, whichever the setting is. It could be an emergency room setting or an intensive care or progressive care setting. And then the person will speak to you, so you're able to communicate with him. Just like any patient, you want to do a good history. Then when you do a good head-to-toe assessment, starting from the head, the eyes, the pupils will be appropriate to whatever the scenario is, but they will not be reactive to light and accommodation. So you'll be able to look at that. The nose, you can put an NG tube in if you need to. Looking in the mouth, we have the ability to create a situation for you where we can inflate his tongue so he has a hard time breathing. We might put a little red stuff in here, make it look like he's bleeding. So you'll want to check his mouth out. Also, the airway works, so this patient can be intubated. This patient can have, you can do a bag valve mask and breathe for him as well. As far as pulses are concerned, we have bilateral carotid pulses. We have pulses in the left arm only, not the right arm. So you'll have a brachial pulse and you'll have a radial pulse. You can have bilateral femoral pulses. You can see here we have a mister here, so you'll be able to feel the bilateral femoral pulses. All right. Then we also have posterior tibial and dorsalis pedis pulses. Now the posterior tibial are sometimes a little more difficult to find, but they are there. Now what we don't want to do, like we do at work, is mark them with a pen. No pens allowed on this skin here. Okay. As far as sounds that we have heart sounds, and we can give our mannequins a normal heart sounds, or we can produce abnormal sounds like mitral regurg or an S3 and an S4. So what you're going to do is you're going to take your stethoscope and place them where you would normally place them. Near this button here is pretty close to the second intercostal space, so you start off, as you know, on this area in the right sternal border, and then go to the left, and then work your way down. We also can produce breath sounds for you, and they will be bilateral, or they may not be. We even have the ability to, even if you listen down here, you can hear them in the lower lobes. We have the capability of creating an atelectasis or rails, or to make the scenario as real as we can for you. Okay, the left arm is where we put our IVs, and we will have, on some scenarios, we will have blood. Excuse me, the right arm, we will have, on some scenarios, we will have simulated blood. So you can draw blood. You may need to do that for cardiac markers or your basic labs. We have a tube top color code for you. If the patient has an arterial line, it will be in the right radius. If he has a CVP line, it'll be in the right subclavian. If he has pulmonary artery catheter, it'll be in the right subclavian as well. That's typically the way we would do it. If he has a chest tube, that will be over here on the left, in the left chest here. So we could hook that up to suction as well. You may have a Foley catheter. So you're going to look at all of those things. Now, to do vital signs, you can put the cuff obviously on the left arm, right? The pulse oximeter, you're going to simulate like you normally would. You would check for color and warmth, and then when you put it on, then you'll see your pulse ox. Okay. We also have belly sounds. Almost forgot. So you can listen. Take your stethoscope, and you can listen for belly sounds as well. You won't be able to do any palpation. We don't have those kind of capabilities. If you're going to give meds, if you're going to give IV meds, you'll be giving it with this. We have our pumps for you. If you're going to be given oral meds, you'll simulate giving them oral meds. Okay, and so far, be sure you ask your instructors or whoever's with you if you have any other questions. Okay?